more space, as you'll see. But before we talk about today, I thought I'd remind you of what we heard yesterday. Huge thanks to the 6 rapporteurs and the 3 chairs that managed our day for us yesterday. So if you remember, we had the big scene-setting presentations, and then we talked about programming approaches around the prevention of MAM, and then we had a particular focus on infants below 6 months. So from Francesco, we heard about the global burden of moderate acute malnutrition, and phenomenally that 9 countries host 55% of MAM children. And we started to raise the issue about the close connection between wasting and stunting, and that in the same child you may see both conditions at the same moment. And in our discussion, we raised the issue that we are so dependent at the moment on prevalence estimates of MAM, and yet for such a rapidly evolving condition, incidence might be a better measure, except that that seems to be unfeasible in terms of access to data and information systems that currently exist. So then Patrick went on to present a review of what works in managing MAM. And basically, he challenged us to really consider improving the quality of usable evidence. And he cited the patchiness, the flawed, the conflicting or inconclusive evidence that currently exists, particularly in terms of nutrition-sensitive approaches. But he also said that we're moving, and the next 2 years is going to see an enormous amount of new evidence emerging. So watch this space. But also really pay attention to the design of research programs and really think about what questions you'd like to be able to answer at the end of those programs and design the programs appropriately. He talked about what we do know, and he pointed to the conclusive evidence that food supplements work in treating SAM and MAM, and that lipid-based ready-to-use foods produce better results in terms of weight gain and recovery than fortified blended foods. We don't know very much about the progression from MAM to SAM, and he concluded by saying that this meeting is important in terms of helping us really shift focus on the quality of our evidence and the links between that evidence and policies. Can I just apologize to presenters if I'm completely misrepresenting what they said, but this is my take-home based on rapporteurs' feedback. Okay, and then Professor Butter talked about the phenomenon of maternal malnutrition and how that closely links to the incidence of MAM in children. And he really honed in very quickly on the issue of adolescent girls and young mothers, and how maternal malnutrition accounts for about 20% of poor pregnancy outcomes. And he looked at the anthropometric results for women and basically showed that if we take women as a broad group, you're missing the fact, or we are missing the fact, that in older women we're seeing an increase in obesity, whereas in younger women we're seeing an increase in wasting. And the whole challenge of tackling undernutrition in terms of micronutrient deficiencies, and that anemia really hasn't shifted very much over the last couple of decades. Small for gestational age is a risk factor for later stunting. And 27% of births in low and middle income countries are small for gestational age. So it's a huge lead-in to the phenomenon of stunting and undernutrition in children. And SGA carries a risk not only of stunting, but also in death, right up to 5 years. So it has long-term repercussions. But he pointed to the lack of evidence around how we can better approach addressing undernutrition in mothers, and particularly in adolescent mothers, and needing a stronger focus on addressing determinants of undernutrition. But the bottom line is that we would do well to try and reduce the number of girls who are having children when they're lower than 18 years. We had our UN panel to talk about how the 4 key agencies are responding to the challenges of addressing MAM effectively. And we heard about various efforts in working together to bring out the complementarity in their respective mandates and to build more coherent programming. Not easy, but there is that sense of thrust and moving forward. And a key issue that came out was a quest to remove the division between SAM and MAM that's emerged between the agencies, but also between programs within an agency. And as one example of that, we heard about UNICEF and WFP discussions around harmonizing products so that they can deliver the same specialized food for both SAM and MAM cases. And then we heard from Tanzania, Bangladesh and Guatemala about their approaches to tackling undernutrition and MAM at national level. And really the challenge of the challenge of needing very strong government leadership and coordination to make sure that efforts are aligned and really do prioritize key areas, geographical areas, as well as looking at the specific causes in that nation. And a challenge for the governments in terms of integrating MAM prevention and MAM management programs within their budgets and really trying to take on the onerous task of making MAM management a sustainable process under the government's lead. Andre then exposed some evidence around the linkages between wasting and stunting. So we heard that starvation, when food intake is very limited, the body's reaction is to use up fat stores, which is basically a survival mechanism. But where there's malnutrition with an additional stress, like an infection, then the body's adaptation means that we lose muscle mass as well. And he went into those dynamics about muscle versus fat and how that changes in different ages and in different types of undernutrition, and came to the conclusion that the highest risk of mortality is in young children, and young and wasted and stunted children. So the 3 combination has the highest risk of mortality, and that we can identify those at highest risk using MUAC. He talked about the fact that wasted children will grow poorly in stature. But wasting is not a cause of stunting. But he made the programmatic link in terms of programs that will address wasting will also ultimately benefit a stunting scenario. And then there's a bit of an exchange around, he made the point that there's no clear rationale for having different programs for wasting and stunting. Again, sort of thinking back to the UN panel's discussions, except in children with adequate fat stores. But then the point was made, well, how do we know if children have adequate fat stores? And if you start treating stunted children who are not wasted, then that's when we start seeing obesity in children and later life. So not easy in terms of responding to that programmatically. We then had a review of programming options for the prevention of moderate acute malnutrition. And the focus was in areas where, either in emergencies or in areas where there are marked lean season changes in the prevalence of MAM. And those contexts are really difficult and tricky to manage. And Linda talked about work that had been done through the Global Nutrition Cluster's MAM task force, where they mapped out MAM-related interventions and saw that blanket supplementary feeding programs were found in 44 countries. But they all had slightly different designs and methodologies and approaches, which led to the task force developing a decision tool in order to help operational agencies determine how best to respond to MAM in a specific context, with a particular focus around blanket supplementary or vouchers or cash, but then in increasing attention on other interventions that could legitimately and usefully prevent MAM. What came out of that review was the importance of, wherever possible, integrating interventions on MAM within existing systems, whether they're through health or food systems, and as close to the community as possible. So this was Rebecca's presentation on a review that the CMAM Forum did on different approaches to the prevention of MAM. And basically a lot is going on, it seems, both in terms of nutrition sensitive and nutrition specific, in terms of food-based and health-based, environmental, looking at women's position. The sort of thing that we're going to go on and talk about later today, actually, is a sense of emerging evidence around the importance of environmental enteropathy rather than diarrhea per se as a key determinant of undernutrition. Whether that's MAM or stunting, we'll hear more about later. And a particular focus around the importance of women's welfare and women's mental well-being as being a really critical factor in how the feeding environment and the care environment that children are being brought up in might jeopardize children's nutritional status and increase their risk of MAM. Then we had the other Rebecca Grest presentation on the challenges of assessing impact effectively. And she talked about the randomistas versus the big numberists. And she presented three different types of research that had been done. But basically she said, you know, we're very good at polarizing debates about hardcore randomized controlled trial being the best and the you know, what we should all be striving at versus program experience. And she was challenging us to help reduce the divide and saying that actually we need more of everything because we learn different things from different evaluative mechanisms. And she underscored that we need to really understand what is plausible in a given context and fit a program to suit. Now, I'm out of time, aren't I? Then we had a very animated debate about cash. And the big take-home message there is it's expensive, but it might be a really important mechanism. So highly context-specific and challenging in terms of sustainability, and possibly not something that should be sustainable, but don't ditch it altogether necessarily. A number of questions remaining. And then we had our final session, which was on infants, which I thought was fascinating. A reminder that there is a question to us all about whether you think MAMI as a catch-all term should be modified and changed. And we've been asked to vote for different options. And looking at whether MAMI is a symptom of broken down relationships in different forms. I thought that was a really helpful way of thinking about it. And in infants, one of the critical issues is whether moderate acute malnutrition presents with other medical complications, and that's a critical risk factor. MUAC coming out as a much better predictor of mortality, and low MUAC in infants has a phenomenally higher, is associated with an 8 to 12-fold increased risk of death by the age of 5. And then we heard about the Bangladesh experience of using peer counsellors to help mothers continue with breastfeeding, and a challenge to establish a global network so that we can really move forward on joint research and shared understanding of design and methodologies.